Hey, how's it going? How's it going? How's it going? Some more. It's Politics with Laura here. And there is something new that the White House is doing, President Trump's initiative. And this was something that was tackled, let me see, back in the 80s. 19, within the 70s. It was under Jimmy Carter. And he fully funded mental health asylums and put enough money in there to help the American people back at that time, about, 45 years ago? 40 years ago? 40. Okay. Okay. 46 years ago. So, there is a new effort because we're at the point to where mental health has it's on a verge of collapse. Within my humble opinion.
Mommy, because I thought we were supposed to conserve it.
And I like that intro. I do. Oh my goodness, I'm sorry. This right here is no laughing matter. But now something's finally being done about it. Now, let me start off saying this. Let me say this. The mental health system is at a brink of collapse, and it is. It's not only due to having the foundation for it to stand on, but it is isolated from the physical side of practicing medicine. And there has not been a way to branch the two sides, treating a patient into a holistic treatment plan. It is unfortunate that Americans are losing. I am not suggesting that the doctors do not take mental health seriously. They do. The system doesn't do enough to fund. However, there is a push to correct that. This oversight, in which, in my opinion, is a good thing. And it most definitely is. Now, when I say that there is between physical health, when I say physical health, I mean medical doctors. You go in, cough, broken leg, whatever it may be. But they don't include the mental health, which should be. And because there's not like a real foundation for mental health, there isn't at all. There's a foundation for the physical health. They have a foundation, protocol, all those things. But when it comes to mental health, there isn't. And when you look at situations that has occurred over the years, and like the people, okay. Let me back it up for a second. It's to the point to where you have to commit a crime. You have to commit a crime in order to have the mental health people assist you. Now, if you're outside or wherever you may be and you're having a mental health crisis, you have to have the police come and DF-12 you, whatever it may be in your neck of the woods. So you have to turn a mental health issue into a criminal act for a judge to say, hey, okay, you need help. And I'm going to give it to you because I'm going to order the mental health department or to put you into a psych ward to force you to get the help. Now, the fact that it gets to the point to where that it takes a judge to force somebody to get help. There should be more, and people may say, hey, politics with Laura. This is ridiculous. You can't make people get help. Ethan Crumbly in Michigan, he's the one back 4 years ago, and he was screaming, help me. I hear voices. I'm not going to disparage his parents. I'm not going to do that. But however, the school failed him. The principal failed him. The superintendent failed him. The teacher said, hey, this boy is over here drawing pictures of guns and massacres. No. But let me show you this real quick. Now, I did this 4 years ago on my other channel, Big Girl Diary, and I'm like, I come a long way, right? I come a long way. Wait a minute. And it's quite interesting. Just like, man, okay. All right, so this is what I'm going to talk just a little bit about it. This was taken 4 years ago. I taped it 4 years ago. And let's take a listen.
The parents, I'm not sure. I think they did the best that they could. I don't know. But that young man was failed by many people before any of this even begun. The school in Oxford, Michigan, noticed this boy was spiraling. They brought him into the office, talked to him, let him go. And the same day of the shooting, brought him to the office and the parents. 3 hours later, the shooting occurred. Now, what went wrong was that the school did not do their job on several fronts. And if they're not sued, something wrong with that.
Okay, we'll leave that right there. And the school did get sued. The school did get sued. It did. And that's not the only example. Down there in Uvalde, Texas, Wisconsin, and there are other places to where students that need help. Now, schools are mandated to have at least a social worker there for students that have psychological issues, that need somebody to talk to keep track of them. But a lot of times it's part-time. No. And that's the problem. And that's only like a small faction of it. Now, when you go to the hospital, you go in and you'll get a psychiatrist or someone that works in the mental health department will come down and evaluate you. But there should be a place to where they are there in the emergency room, not you got to wait hour, 2 hours, 3 hours. And there ought to be a little bit more people on staff because there are more people that are having mental health crisis. And it's getting to the point to where now it's like it's coming out in record numbers. There are a lot of people starting to have mental health issues. And what does one do? When you go outside and you need help, people are afraid of you, right? And sometimes people with mental health issues can act in a violent manner and they yell, scream, holler, and within themselves, they think everything is fine with how they're acting is normal. But when you point it out, hey, you might want to go talk to someone. That's never a good way to do it, but it winds up happening that way. So President Trump is has this thing called Maha. Maha. I was like, what is that? I gotta look that up. What does that mean? And Maha means Make America Healthy Again. I'm like, I like that. I like that acronym. And the Secretary of Health, Robert F. Kennedy Jr., is doing a lot. And one of the things that he's also doing is mental health, and not only food and taking the additives out and having these big companies, they put all that artificial stuff in their food. They're like, nah, you can't do that. Stop it. Right? So we have a lot of that going on. So let me go ahead and just show you this. Congressman Grotham, he oversees the, oh my goodness, what is it? Is it the Oversight Committee? I don't think it's the Oversight Committee. I can't remember at this very second. But just take a look at what he says. And I'm like, okay, finally. This is getting done, finally. All right, let me take this back a little bit. What's going on? Oh,
To be getting worse. I was.
sorry about that.
We are now going to examine a difficult but urgent issue, the state of mental health in this country, why it appears to be getting worse. I would say both growing and getting worse at the same time, whether the system designed to address it is working, and what we in Congress can do about it. Over the past 2 decades, the United States has dramatically expanded access to mental health care. I might add that when I graduated from high school, if someone said, how's your mental health, that was just something nobody would ever say. It was so, now it's common. In 2002, about 27 million adults received mental health treatment. By 2024, that number had grown to 60 million. So stop and think of that first.
Yeah, stop and think about it. 20 years ago, 27 million people getting help, and now it's 60 million. There is something going on. There's an actual crisis going on in this country, and the level of care that the government has given is, they did some, but not even enough compared to what we need now. Now, if you go back to the 70s, the late 70s, when, as I was mentioning, Jimmy Carter, he fully funded the insane asylums, and that's what they did. People went to the hospital, the mental health hospital, or as they call the insane asylums, which I don't agree with that terminology at all. I do not. But however, if you needed help, you got help. If you needed medication, you got medication. Now, I'm saying back then, it's not compared to what it is now and how they do things completely differently. But however, you had to start someplace. But then when Ronald Reagan got in, he totally gutted it out. And then he opened up many community centers. Now, they need to do much more than just community centers. They need to fully staff it, fully fund it, and put people in there that are qualified to do the jobs that they need to do. You have case managers, at least have a bare bone minimum of a 4-year degree. Higher would be more acceptable within mental health, but however, that's not what they do. They grab people out on the street, say, can you check no? And they check no. But also, I think the good thing is that they have wraparound services. Now, going to a regular hospital, they don't have that type of program, which they should. But these mental health communities have wraparound services, and normally people that have mental health issues do drugs. And they sort of go hand in hand. I'm not going to go back into the legal part of it, because if you have mental health issues and you have drug addiction, the judge is going to ignore the mental health part and focus on the drug part. And then this person is still going to be dangling in the wind. However, now that they have these wraparound services, and which is a good thing, and the mental health clinics can get these people into these programs to help people. So not only do you have mental health, not only do you have drugs, you also have classes to help people that have some sort of depression or whatever it may be. They can get into groups and be able to exhale what's bothering them. And that's the big part of it, is them people that have mental health issues keep to themselves. They don't talk about it. They pretend, all sorts of things. So on one hand, I do believe these mental health clinics out within the community are a good thing. The bad part about it, in my beliefs, are the people that own these places do not fully invest, in my humble opinion, invest and pay people with their worth to get the best people in there to do the job to help the community. It's like race to the bottom. Race to the bottom. And I would be remiss to say that the government needs to do more. But let me stop right here and let's finish what he's talking about.
Like in the last 24 years, you're twice as likely to go to a mental health professional. You would think that spending all this money and having that many more people work on the project, that it would result in positive outcomes. But no, the outcomes are moving in the wrong direction. Depression rates are at historic highs. Suicide rates, while they dropped during the COVID, have climbed back to their highest levels in decades. And I'll point out that's despite the fact that presumably physical health care has improved, so it's harder to kill yourself, but it still goes up. As you can see from the chart behind me, do you have the chart behind me? Here we have, on the blue line, you can see that the amount of people receiving mental health care is going through the roof. However, the number of people who report that their mental health is good is falling like a stone. Okay?
Just like I said, people that need mental help. Okay, let me put it to you like this. People who need mental help believe that they don't need mental help, especially depending on how far gone they are. Now, you have some people who have depression. They're like, okay, I need to go talk to somebody. And sometimes they don't. And it turns disastrous until at some point they're like, okay, I do need help. Let me go ahead and do something. But you have those people that have like bipolar or schizophrenia or a combination, or if they are dissociative, have dissociative personalities, it can really get out there. But if and even now, narcissism is not new, but now they have a name for it for people who are so self-absorbed. I'm not gonna get political on that one, but people who are so self-absorbed that no matter what they do, it's correct, and you can't criticize them, or they'll like, right? But however, when you have those people who don't understand that they need help and what they're doing is not normal, and it's hard to get them to understand that what you're doing is not normal. I mean, you're running around with socks on and a scarf, and it's cold outside, and you're out there like that. Oh, this is normal. I'm sitting on a concrete. The fact that I saw that that was shocking. But, getting that man help, that was whew, many moons ago when I saw that, when I was in my late teens. But getting people that help. So, let's listen to him, what else he has to say.
That raises a fundamental question. If we are treating more people than ever before, why are we not seeing better results? This is not just a public health concern, it's an economic concern too. A study published last week found that from 2000 to 2021, the mental health and substance abuse disorders nominal spending grew from 41 billion to 139 billion. Mental health and substance use disorders accounted for.
Wait a minute. Did you hear that number? That number was staggering. Let me go back just a little bit.
Billion to 139 billion. Mental health and substance use disorders accounted for 4.5% of all medical services spending in 2000 and 5.5 in 2021. Which means, given how quickly medical spending is going up across the board, to have them go up even more is somewhat incredible. Real per capita mental health and substance use disorder spending grew at an average of 3.27%, which is faster than the growth rate for overall medical services of 2.21%. On the government spending side, more than 1 in 3 SSDI beneficiaries are enrolled due to mental disorders, making it one of the largest drivers of a program originally intended only for those with severe mental limitations. At the same time, many Americans are bearing these costs personally. 1 in 10 Americans have gone into debt to pay for mental care. And of course, the reason they go into debt is they think they're buying something of value. Perhaps most concerning is what we are seeing among young people.
Hold on for a second, because he said something rather key. People are going into debt because they believe that they're buying something of value. You have people going out there and saying, hey, if you got this, I got this for you, but you got to pay me this amount of money to do it. And they're, okay, I'm going to leave that alone right there. Let him continue.
Mental health diagnosis in children and adolescents have risen dramatically, along with the use of psychiatric medications, which are scary. Antidepressant prescriptions for individuals aged 12 to 25 have increased by more than 63% from 2016 to 2022. Let's run that by again. The number of people aged 12 to 25, the formative years, antidepressant prescriptions have gone up 63%. During that time,
right there makes me wonder. People who are taking antidepressants, could talk therapy help? Do they need that? Because in those formative years, when you take medicines like that, it does a lot to your brain. So there should be additional methods, just in my humble opinion. But let him continue.
Total of more than 221 million antidepressants were prescribed and dispensed to 18 million individuals aged 12 to 25. Yet even as treatment has expanded, outcomes for youth continue to worsen. In 2021, 57% of teen girls reported persistent feelings of sadness or hopelessness, up from 36% a decade earlier. The point is, we have more professionals in this, we're throwing money at it, and young girls are wildly more unhappy than they were just a few years ago. We're intervening more, medicating more, spending more, yet many of the people we are trying to help are not getting better.
And right there makes me ask this question. If you have more young girls that are unhappy than 10, 20 years ago, then what is it about society today that would make them become unhappy? I mean, we have a lot going on. I mean, there's so much going on now. I see even a bigger spike of people that that will have depression and more mental health illnesses popping up, and maybe even new forms of it. Just a thought. I hope that never happens, and I'm hoping that it will decrease and get a handle on this situation. But it makes you stop and think, what is it going on? What's going on in this society that you have these issues?
There's something in this system that is not working as intended. Let me be clear about what today's conversation is not. This is not an argument against mental health care. Well, maybe a little. Nor is it an attempt to stigmatize those getting help. When a system produces outcomes like these, despite significant investment, we have a responsibility to ask questions. Are we wasting money, or are we spending more money and even making things worse? Recent efforts, including the Trump administration's Make America Healthy Again Commission, focus on over-medicalization in its direction to evaluate pediatric prescribing patterns, suggest that some of these questions are beginning to be taken seriously. Our constituents know something is wrong. They're living it, they're watching their kids struggle, taking on debt for care, and searching for answers when systems fall short. They deserve a system that works, and they deserve accountability when it does not.
I gotta say, he's speaking nothing but facts. Because there are several things working at the same time, and people do go into debt to help their children. It's and especially if you don't have money and you're using government insurance, you're going to get the bare bone minimum because you're using government insurance, and the government really doesn't pay the way it should. But if you have those private insurances, you're going to get better standard of care. So that's just one faction of it. And the other part that he was talking about is, okay, we're giving you a lot of money, and what's happening to the money? Where is it going? How comes you're having worse results than we had X amount of years ago? And I have to say that that's absolutely true. But now where's that money going? I have no idea. But I do have one question that I stated earlier. You have people that have these mental health companies, and they're all about profit and cutting costs. But they're also still getting money from the government and having people being referred to those companies. So, what are they doing with the money? Or do we get rid of these community mental health clinics, and do you go back to the hospitals? Now, do you go back to the hospitals? Will they give wraparound services? Will they help people? There's a lot that's going to happen, and I think that would be a good thing. I think that would be a good thing to most definitely to get a tighter hold on what's going on. So this is the last thing I want to bring up. What I do? Okay. Now here, this is what he was talking about right here. And right here, the Subcommittee of Healthcare and Financial Services. Sorry about that. People caught the wrong time. So here, and this is a roundtable where they're going to re-examine the mental health and the Make America Healthy Again age. And this is an opening statement, the subcommittee Chairman Grothman, in which you just heard what he said. So here he said 2002, about 27 million adults received mental health treatment. By 2024, a number had grown to 60 million. Now, just look at that. That's almost three times the amount of people. Whoa. So what's going on in this country to where this right here is occurring? What is it about the United States? What is it about the social and the political climate that's making people's mental health decline? Why are people declining as far as their mental health? Why are they getting these bipolar, oh my goodness, dual personalities, or I can't remember. I just said I can't remember at this very second, but having all these issues, and narcissism is through the roof. So what is it about this country? And here the depression rates are at a historic high. Self-deletion rates have climbed higher than. So, President Trump is trying to fix this. And here, the spending grew from 40.9 billion to 139.6 billion in mental health and substance use and disorders. It's a lot. It is a lot. And something most definitely really needs to be done about this situation. And it's not going away. It's only going to get worse, just as he stated, and has been getting worse. So how do they stop it? But I'm saying all of this to say we are in a crisis, a mental health crisis, and more needs to be done, as he's saying. More needs to be done, and we're throwing money at it. People are throwing money at it, but as we throw money at it, is it working? And I gotta say, if you have money, you'll have a better shot. But if you're relying on Medicaid or some sort of government health insurance, you're gonna get the bare bone minimum, and that right there has to stop. Because if somebody is using government insurance, that means that they need help. And if they have mental health issues and they have government insurance, you might want to help that person to become more productive. That would be the smart thing to do, in my humble opinion. But outside of that, what are your thoughts?